It's my pleasure to speak with Dr. Emily Sena, Research Fellow at the University of Edinburgh. Dr. Sena, how can we use translational research to develop disease-modifying therapies or even to prevent epilepsy?
So I think that translational research, if you can characterize it in lots of different ways. My expertise are in translating what you see in an animal study to a clinical trial. And I think harmonizing how people design their animal studies, what they look for in terms of outcomes, the rigor in which they conduct them, and harmonizing that with how the clinical trials are designed, I think will ultimately ensure or increase the likelihood that one informs the other. And it doesn't work one way, I think it works both ways. I think when you perform a clinical trial and things don't work, I think learning from that and designing your animal studies to then test new hypotheses and generate new hypotheses to then go back and test in the clinical setting, I think will be useful.
And what do you think are the most significant causes so far in translation failures?
So I think that a lot of people try to blame the animal studies entirely, and my expertise are in looking at the shortcomings in the animal studies, and those relate around to the rigor in which they're performed. So things like randomizing an animal to a treatment group, things like blinding the assessment of outcome, which are routine in clinical RCTs, are very rarely done in animal studies. And we've shown that when studies don't do these things to reduce the risk of bias, they tend to overstate or overclaim the impact of a drug effect. Again, you've got things like sample size calculations. Again, a clinical trial, you would need to determine that before you started, whereas we've shown that hardly any, across all different neurological disorders, hardly any animal studies tell you a priori how they decided how many animals they need to identify the effect that they're looking for. So you've got things around that internal validity, but you've also got external validity, so generalizability, things like target validation, what it is you're looking for in an animal model, and identifying that and making sure when you test something in an animal model that it relates to the bit of the human disease that you're looking for. And again, I think there's a mismatch between the two. So I think improving the rigor in which they're performed and also making sure that they are generalizable are useful. And I think the final thing probably that is often forgotten is making sure that every animal that is used in an experiment, that their data contributes to our scientific knowledge. Because otherwise I'll do an experiment and it'll be a blind alley and I don't publish it, and then you will do exactly that same experiment and we're just repeating the same errors. But if I disseminate that data and publish it, and it's not easy, the system that we're in, it's very difficult to publish neutral or negative studies. It's not rewarded in the same way as big effects, so the effort required is a lot less incentivized to do it. But I think overall, in the bigger picture, getting that data out there is important to the advancement of scientific knowledge.
And what do you think the benefits of overcoming these problems will be to both patients and doctors?
I think it reduces waste. I think there's a huge amount of waste in terms of time, resources, animals that are used in experiments, patients that are enrolled in clinical trials, the doctors that are running these trials. And I think if you are entering a clinical trial with robust data to start with, it vastly increases the chance that you haven't wasted so many resources, and you're increasing the value of the research. So I think in turn, less patients are exposed to treatments that are not effective, and research and our resources are used much more efficiently.
Yeah. Well, thank you very much.
No, thank you.
Dr. Sena.